a traditional Chinese medicine herbalist and has studied acupuncture. She is not of any direct relation to me, although I'm sure we're related. We're all indirectly related, right, as humans, but she is on our Wellness Webinar today as our guest. So welcome, Rebecca. Thank you so much for coming on.
Well, thank you so much for having me. It's nice to be here.
Yeah, so Rebecca is also on the East Coast from Toronto, and she was just telling me it's sunny today there. I think that it's a great city if anyone's been to Toronto. Um, and I kind of wanted to ask you a little bit about how things are in Canada, but I'll do that in a little bit. So we'll go to the CIH community updates briefly, and then we'll chat with Rebecca. So the updates in the DC area in terms of Maryland, Virginia, and DC, the ages greater than 65 and older are eligible now to have vaccine, COVID vaccine. There is research ongoing to test vaccine's effectiveness against the viral variants, specifically the UK and the South African variants of concern. The studies that have been done pretty recently have shown that the Pfizer and Moderna vaccines seem to be at least partially effective against the South African vaccine and pretty effective against the UK vaccine. I think Pfizer just came out with an article, it's published in Nature this week, that showed that it was actually effective against both, but you can read the links there. And then, unfortunately, the current version of the Oxford vaccine, which hasn't been approved yet in the US, has not been considered to be effective against B1351, which is the South African variant, based on it was only like 10% efficacious. So the US has not approved that one yet. And I know they're going to be working on another version of that vaccine to be more effective against the South African variant. So I'll keep on researching this every week and presenting the latest research here. We know that with COVID-19 and immune health, that the health of your own immune system is equally as important as measures to curb viral spread. That's where traditional Chinese medicine comes in. We know that there's many studies from China, especially. One was published recently by Phytomedicine in January of this year. Traditional Chinese herbal medicine at the forefront battle against COVID-19, clinical experience and scientific basis. And in that analysis, they came to the conclusion that many TCM formulas indirectly affect the virus via restoring immune balance. It is important to social distance. It's important to do all the things that we want to do to curb viral spread, but it's also important to reduce inflammation, to improve detoxification, to live a healthy lifestyle with nutrition, movement, stress management, and adequate sleep, to treat the metabolic syndrome, which we have talked about many times here, to get the vitamin D levels up, to get your blood sugar levels down towards a normal range so that your immune system doesn't become overinflamed if you get COVID or any other virus for that matter. So it's really important to prep our immune systems for whatever's going to come next, because this is probably not going to be the last time we have a virus like this, unfortunately. We're going to have to keep on strengthening and balancing our own immune systems. So we do have some webinars coming up every week, every Thursday. It's 12 to 1 p.m. Here. Next Thursday, we have naturopathic doctor, Dr. Carrie Jones, on for a second time, talking about hormone Q&A. So that was very popular last time, and we're going to bring that back by popular demand. So that should be great. And then I'll be talking with our great Mukit and Araceli here. That's coming up in a couple of weeks. We're going to be talking about the Evoke brain scan for brain health and how to optimize that. So looking forward to those times. Now, Rebecca, this is interesting. So Rebecca Wong, she grew up on a dairy farm in Ontario and has worked in the herbal industry for 20 years, starting in 2000 under the guidance of her mother-in-law, Julia Chang. Started manufacturing some herbal tinctures and advising clients. And then she then, I guess we can talk about this more in your interview and discussion here, but started getting some chronic fatigue and started to treat herself with Chinese herbs and continued Julia's work after her retirement. And she graduated from the University of Waterloo in 1993 with a BA in English, and more recently studied herbalism at the East-West School of Planetary Herbology under Michael Tierra, and also Chinese medicine at the Ontario College of Traditional Chinese Medicine in Toronto, and currently runs with her husband Michael Prime Health Products in Toronto. So Sensible Health, is that more of a blog site, that the sensiblehealth.com, right? Rebecca?
Yeah, actually, my mother started the business before the internet, way back in the early 90s.
Nice.
And she started with the name Prime Health Products. But then when the internet came about and she wanted to create a website, Prime Health, I guess, was taken by someone else. So we decided to take the label sensiblehealth.com. So I know there is confusion there. Some people are like, are you Prime Health or Sensible Health, or am I talking to the right
Yes.
people?
Well, welcome to the webinar. I think we can start with how did you get involved in traditional Chinese medicine? We kind of went through that a little in your bio, but how did your interest get involved in that?
Yeah, I was not exposed ever to really any kind of herbal medicine growing up where I did on a farm in rural Ontario. But
Yeah.
when I married her son, Julia Chang's son, she was running a health food store at the time, and she advised people using Chinese medicine principles, as to what products to buy. And I started working with her as just as a summer job initially, and then we started kind of working together. When she started making her tinctures, I was helping her making the tinctures, and also I handled email correspondence for her for years.
Hmm.
We built a relationship together that way.
Great.
And then I wanted to solidify my knowledge, so I went to school. Yeah, that's how it came about.
And I know everyone wants to know this, but what is traditional Chinese medicine? If you could just give us like a broad definition, that would be really great.
Well, I guess it's a more holistic way of looking at health. I know in Western medicine, it's usually a more symptom based. You have this problem and this is the drug that helps it. Whereas in Chinese medicine, it's more about balance. Usually there's some kind of imbalance you have to correct, and that will often resolve multiple problems at once just by
Hmm.
correcting that.
Is there a diagnosis also in traditional Chinese medicine? You know, in Western diagnosis, there's like chronic fatigue or
Right.
fibromyalgia or something like that. How does it work in traditional Chinese medicine?
Yeah, we would not diagnose something with a distinct name like fibromyalgia or chronic fatigue syndrome. And we use weird terminology. I know a lot of people, I'll say like you have deficient qi or deficient yin or something like that, which maybe doesn't mean a whole lot to people who aren't sure about the terminology, who've never heard it before. So it's
What is qi? My understanding is it's basically energy, but I know that's also a very broad term. What is the sort of the definition or concept of qi, just so we can get everyone on the same page before we go into some of the discussion?
right. It's basically a vital force of energy. Energy can't be created or destroyed, they keep saying. So basically what you want to do is remove any blockages to facilitate, as much to keep the energy moving and strong within your body. Yeah.
Hmm. What are some of the benefits of traditional Chinese medicine that you've seen? And I think traditional Chinese medicine, before you answer that, it's a very broad term. You know, it can encompass things like nutrition, it can encompass things like herbs, right? And then acupuncture, qigong. There's like different, I guess, I don't know if the branches is the right word, but different aspects of traditional Chinese medicine.
Yeah, so there's, it's primarily, I guess you could say, food, herb and diet based, in that that's the way that they primarily get the nutrients in you to help facilitate change.
Yeah,
Although obviously, gentle exercises like qigong and that kind of thing can also help. So it is kind of a big package, as you say,
yeah,
with many
yeah.
branches. Mhm.
How many of you have heard of traditional Chinese medicine or know something about them? Just kind of wanted to ask the audience here, or our listeners here, who is got some chats as well. I'm not sure if we can Sherry possibly. Yes, thank you, Mustafa. Studying it now. I didn't know that. Oh, that's great, Christy. Yeah, so let's see if there's a chat, absolutely chat, or you can come on the video as well. Welcome to do that. So, how do you use traditional Chinese medicine in your own life, if you don't mind me asking that? I'm just kind of curious, and then we can get to some of the general
Um,
questions.
yeah, I take herbs a lot. Like most every day I'm taking herbs. As it said, in my bio, I do have a chronic fatigue syndrome. So I know initially when I got sick, I didn't know as much about how to treat myself. And so sometimes I'd feel low in energy, or I wouldn't sleep well or whatever, and I wouldn't know what the problem was or how to help it. And I found that Chinese medicine has been really helpful for, I can tell by feeling my pulse and looking at my symptoms, okay, I need to boost this or I need to do that. And it helps to keep me basically on an even keel and not sort of sliding out of balance.
Hmm. So the first general question I think kind of goes along with your experience with chronic fatigue is how does traditional Chinese medicine approach chronic fatigue? Which herbs might be you think about, for fatigue?
Right. So it's a pretty complicated problem. I mean, like anything with chronic fatigue or with any illness, we don't actually treat the label. Any people who have chronic fatigue syndrome may present with different particular issues. Like for me, I know I had a lot of dizziness and low blood pressure.
Hmm.
Those are some of the hardest symptoms to get over, whereas other people might have other symptoms that are more predominant. So you would treat based on the symptoms. So if you happen to show signs of qi deficiency, obviously then qi tonics would be appropriate. If it's
Hmm.
more of a blood stagnation issue, then taking too many qi tonics will probably make the problem worse.
And it's kind of like with functional medicine, that's what we say in functional medicine as well. It's treating the root cause or causes and trying to figure out, like, someone has fatigue, but they might have different causes of that fatigue. So you have to treat the
Exactly. Yeah.
causes. So what are some of the favorite herbs for you? Let's say for you that have worked for you, if that's
So for me, I think, yeah, one of my chief problems has been blood deficiency. And that's probably a problem that a lot of women have just because we menstruate. So we're constantly losing blood. So if we are not assimilating as much nutrients from our food, or if our digestion is weak, then we can easily become blood deficient. And so for herbs to help blood deficiency, you've got dongui, you've got peony root, romania root, hesho wu root. Those are all good herbs known to nourish blood.
now that we're talking about women's health for a sec, I think one of the things is that, there's always this question that is in my mind between, like, are herbs safe for fertility? Are they safe for pregnancy, breastfeeding? What is your answer to that?
For the most part, most herbs are. The ones that you have to be careful with are the ones that move blood, or they're because they have blood thinning properties. So
Right.
that's what we want to avoid. Yeah,
Yeah, avoid miscarriages, right, and things like that.
exactly.
Yeah, early labor, etc. Okay, so from Amber, what would you recommend for Epstein-Barr virus? So this is a virus that's pretty ubiquitous in the world. About 98% of people have Epstein-Barr, so pretty much most people have it, and very few people don't have it. But Epstein-Barr can, for those of you who are not aware of that, can cause fatigue, autoimmune conditions, even things. Um, Maybe there might be. It sounds like an herbal approach. You may want to know more information about that person, like take their
Yeah,
pulses and all of that.
exactly.
Are there any things that come to mind for Epstein-Barr or other viral illnesses like that?
Yeah, generally, well, sometimes if there's a viral a viral infection that you have and you're having a lot of trouble getting rid of it, there are formulas you can use, because in Chinese medicine, we say like there's different levels where the illness can get stuck. It can,
Mm.
when you first get sick, it can be on the surface, and if it isn't cleared away properly, it can go deeper, and that's where it can kind of linger and get stuck. So there are formulas with that help to release that and bring it out. So if someone's been suffering from a virus like Epstein-Barr for a long time, something like that might be appropriate. And then I suspect she probably is maybe a little qi deficient, because if your qi is strong, you don't tend to get the viruses. So we want to boost your qi a bit so that you're not going to get sick so easily again.
Are you using also the herbs for prevention for COVID as well? I mean, not that, at least from a U.S. perspective, it's like we can't say that supplements or herbs will prevent things, but to both bolster the immune system. What are your clients there doing for COVID-19? I
Right.
wanted to
So
address that since it's like we're all dealing with that now.
yeah. So we do have a tincture that is specifically developed to help not only get rid of viruses but boost your immune system. And it's called, we call it our chrysanthemum tincture, and it basically contains two herbs, chrysanthemum flower and honeysuckle flower. Honeysuckle flower actually is really used widely in China as an antiviral herb.
Hmm.
And when
Did not know that.
when COVID was first over there were people like lining up around the block to get honeysuckle flowers. That's how often they use it there. So it contains those two herbs to kind of repel viruses, as well as astragalus root, which is a chi tonic.
I was gonna ask about that. Okay.
Yeah,
Yeah, that's great. Yeah, I guess the flowers don't want viruses because they would kill off the flowers, right? So they make these
I guess
substances.
so.
Is
Yeah.
that right? I don't know. Yeah. Great. So that and actually, let's just stay on that topic for a second. How is COVID-19 in Canada? How's everything there in Toronto overall?
The numbers are coming down now, but I know they were kind of rising before Christmas. And then I think because everyone gathered for
Right.
Christmas Day, they kind of peaked and everybody started to panic and we shut down again.
Okay.
All the province of Ontario is still shut down, actually, although I think we're reopening next week again. So,
Got it. Good. Good. Good to hear that. Um, so how does traditional Chinese medicine approach hormone balance? That's a very general question, but hormone balance might be something like PMS. There's different aspects of this, but PMS or perimenopause, menopause. There's probably different things.
right.
What is the approach there?
So for something like PMS, menstrual problems, usually you need to address the liver, and that's what my mother-in-law, Julia, she suffered from endometriosis
Hmm.
for much of her young life, and she found that using herbs to clear the liver particularly helped her symptoms. So that's we used to sell to a lot of people, a lot of women, yeah, just basically tinctures to improve liver health and also promoting some liver and gallbladder cleansing to help remove any.
Yeah, let's talk about that. I think Christine wanted to know, speaking to liver support, are there any things, energe liver support herbs to energetically move anger through the body? And we know that anger in traditional Chinese medicine is a liver qi stagnation, correct?
That's correct, yes, yeah. So yeah, we have a Chinese bitters tincture that we've promoted for basically overall improving liver health, and it does contain herbs that spread liver qi, also remove any in Chinese medicine it's called like dampness. I'm not sure how that would apply in Western medicine, but it like drains congested bile from the liver, and because the liver is a filtration organ, basically by removing any congestion there and getting it spreading and flowing better, you can help most
So,
liver.
so the general principle of traditional Chinese medicine, is my understanding, is that if there's energy channels called meridians, right, and they get blocked,
Correct. Yeah.
or because of chronic infection or energetic depletion, qi deficiency, yin deficient, different things might yin yang balance, imbalances, blood deficiency, all these things I think could potentially lead to blockages
Yes,
of
definitely.
of the meridian, of the channels. And so whether it's acupuncture, nutrition, herbs, qigong, these are all potential ways to unblock those channels to restore balance to the body.
Exactly. Yeah. I think there's a saying in Chinese medicine that pretty much all illnesses are some kind of qi stagnation or blood stagnation. And
Right.
basically, once you remove that, the qi can flow freely. Yeah.
And yes, so that's a really fundamental point for everyone to just realize. I think emotions right now, everyone's emotionally. There's definitely a lot of challenges. This in a way is a collective trauma. COVID-19, all the world events happening. How does traditional Chinese medicine and herbal medicine in particular address emotions related to either anxiety or sadness? I guess anxiety or depression. Depression is something that I think it's in the 10 to 20% range, but recent studies have shown that up to 50, 60% of people are depressed right now. It's a
Right. Yeah.
really high number now.
So depression again is a sign of blocked liver energy.
Okay.
So yeah, that's something that I know suffering from depression myself, occasional bouts of depression. You can often think that it's something in your life that's causing the problem, but then if you take some herbs to spread the liver, and then you're like, wow, actually things don't seem nearly so gloomy anymore.
Nice.
So
Yeah.
it's amazing how they can have that kind of effect on your emotional health.
And we know that with Western medicine, like, people asking for a Xanax or something, like something immediate. What is
Right.
the timeline for herbal medicine to work? That
Mhm.
might be good.
For something like liver stagnation causing depression, the effect can be actually almost as immediate within a few days. If your depression is caused by a liver blockage, which very often that the liver is involved,
Mhm.
then yeah, just spreading the liver can bring about
Is
change.
it safe or recommended to, because obviously you can't necessarily take pulses and everything virtually, but is it okay to just treat someone empirically? Like, okay, this person has depression, they might have liver sheath stagnation. Let's try to treat that and then see what happens. Herbs are considered generally safe and effective, right? That's the idea.
Exactly. Yeah. In Chinese medicine, basically, we diagnose people based on patterns. So if you have enough patterns of liver congestion, and it's a common problem, so a lot of people do, you can check off a lot of liver boxes, so that it's pretty safe to say that if you use some herbs to help your liver, it's most likely going to help. Yeah.
Yeah. Most people need more liver support, right? That's kind of a
Yes, exactly.
general general type thing. Okay, so we have some questions about I think we covered immune health. Any other immune tips you have from traditional Chinese medicine? What are your thoughts about healthy nutrition right now, sleep, I guess other, movement, what are your thoughts about that and any other herbal tips you have too?
Right. So obviously, diet and sleep is important. Um, a lot of our customers also do like a little bit of gentle detoxification, as you say, just to make sure their immune system is in peak health,
Mhm,
or take some chi tonics to boost their immune system a bit. Those are
mhm.
all ways to help.
What did you say the chi tonics were? What kind of herbs are in there usually?
So one of the premier immune tonics is astragalus root.
Yeah.
That's the one that's in our chrysanthemum tincture, but there are lots of others, like even ginseng, Cotinopsis root. Yeah, there's a number of different chi tonics that can help, although astragalus is the one that people kind of reach for first.
Are mushrooms part of traditional Chinese medicine? We've had some mycologists on here as well. I don't know where does reishi and cordyceps and where does that all fit in to?
Right. Yeah. So those are also like immune system boosters. Those would be
Mhm,
very good. And mushrooms are also very calming too. So that's the nice thing about mushrooms. Cordyceps is more of an adrenal stimulant. So it's stimulating, for example, astragalus root is more of it stimulates your spleen pancreas. So that's more of a digestive strengthening that way. Whereas
mhm.
cordyceps strengthens from deeper, more from the kidney adrenal level. Yeah.
Great, thank you. We're gonna dive a little into gut health here. I know a lot of people have. Let's see. Actually, let's go back to Jen said. So general diet recommendations for liver stagnation, liver cheese stagnation.
Right. Well, obviously, you want to avoid a lot of fatty foods. So, like deep fried foods, any
Mhm,
kind of fried foods,
mhm,
spicy foods, also. Even avocados, which are a natural fat, if you eat too much of it, can be congesting to the liver. So, you do have
mhm.
to be careful.
Okay, I love
Um,
avocado, so it's good to know. Guacamole and avocado, yeah. How do you approach and then obviously for everyone here, alcohol would also be a no-no.
yeah.
Or
Go
that's
easy
bad
on
for
the
the liver.
alcohol. Yeah.
How do you approach adrenal imbalances? If someone has adrenal hormones are off, maybe their adrenal hormones are low or something.
So yeah, there's two different approaches to adrenal health, and because the kidneys are the root source of your energy, and that it branches into kidney yin and kidney yang.
Mhm.
So depending on the person, because some people may be more yang deficient and some people may be more yin deficient. If you're more yang deficient, then you maybe are not producing enough cortisol, and so you're feeling tired all the time.
Mhm. I don't know if everyone knows what yin and yang is. Can you just kind of go into that a bit?
Okay.
Thanks.
So yang energy is the more warming, associated with warmth and light and heat, whereas the yin energy is more cooling, dark, moistening. So you want basically a balance of both. So if you have too much kidney yang, it's actually doesn't often happen. But if you had too much yang energy, your cortisol level might be up too high. That may give you a lot of energy, but it would be, I guess I'm thinking more of the kidney yin is when your body's not really releasing the cortisol and you're all like, I think probably most people are in that kind of situation, a kidney
Yeah.
yin deficiency right now. They're all stressed and anxious. And in that case, you want to calm your
Calm it
kidney.
down. Got it. Got it. And so yin and yang are different, are like they're kind of like two sides of the same coin. They're types of chi, types of energy. Is
Types
that
of energy, yeah. And you want to
great?
keep them in balance. Yeah.
Yes. Where do you source, or where does your company source the herbs? I know that's a question. How do you test for heavy metals and those type of things?
Yeah, our herbs do come from China. We also get asked often if they're organic. I don't know if there's really any organic farming in China, so unfortunately we can't access that, and we need the herbs in a pretty large quantity in order to make our products. So we have to go with the ones from China. But we do test our products for heavy metals and chemicals, biological contaminants. And after we've been testing since like the mid 2000s, so for the past 15 years of tests, we've never had any detectable levels of heavy metals. So, oh, it's my
Nice.
son there.
Nice.
So I know that they often say that Chinese herbal products are contaminated, and I'm not sure if maybe those are the products manufactured in China.
Yeah. Yeah.
But we've found our products, we have never found them to be high in heavy metals, not even any
Great.
detectable
That,
level.
that that's great that you test that. It's important for sure. I think that's definitely always something of interest. What do you do for constipation? That's a good. What do you recommend for constipation, I guess?
So again, it depends on the kind of constipation. Usually when people get a little older, they might have more of a yin deficient constipation, in which case moistening laxatives would be appropriate. For
Hmm.
more middle-aged and younger people, it's usually a bile blockage, bile stagnation. So we find that by unblocking the liver, getting bile flowing better. Bile is a natural lubricant in the intestines, so it just helps everything come out. Yeah.
Yeah. So helping the bile out, basically.
Exactly. Yeah.
Got it. Okay. And then going along with that, I know I started talking to you about kidney stones and gallstones. Started emailing you. What are your formulas, or what's your approach to? Because we have a lot of people here that maybe they don't want their gallbladder taken out or something, or they don't want kidney stones taken out because that's painful, to have them
Oh
taken
yeah.
out surgically. So
Yeah.
how do you avoid surgery with those, and just a little disclaimer, I mean, if someone's really having severe kidney stones or gallstones, they should go to the ER and get evaluated. We're not saying that at all,
Exactly.
but we're
Yeah.
just saying if there's something chronic there and you're trying to avoid surgery, and we can do that in a gradual way, what is the herbal approach for that, for those
Right.
two?
So one really popular herb for crushing gallstones and kidney stones is gold coin grass, which is the main herb in our GCG tincture. GCG is short for gold coin grass.
Ah, okay.
Yeah.
Okay.
So yeah, we've used it to help people dissolve gallstones as well as kidney stones.
Got
So
it.
it's good preventative.
Gold coin grass. I'll have to research that a bit. Okay, great. And then any other? I know we have there's a lot of gut health issues. In fact, one study from the NIDDK, which is part of the NIH, the Digestive Disease and Kidney Division of the NIH, estimates that 75% of people have gut issues. And if you could, I mean, if you don't have to do this, but if you want to raise your hand or say if you have gut issues, just put that on the chat. I'm just curious if anyone here has gut issues. We know that in functional medicine, integrative health functional medicine, a lot of times the root cause of issues is gut issues, right? And gut is kind of where
That's true.
separate out the outside from the inside, and gut gives us the nutrients, and we also need a gut for detoxification, obviously.
Hmm.
um, yeah, thank you. Thank you very much. So therefore, yeah, what is the approach in traditional Chinese medicine to gut issues?
Right. So yeah, it's I think most herbal medicine traditions have always focused on digestion as being the root cause of
Mhm,
not good health or creating good health.
mhm,
So yeah, that's why our tinctures focus on cleansing the liver, because the liver is a pretty important organ for overall digestion. Often just by ensuring that the liver functions well, you'll help, constipation. We've seen blood sugar come down, cholesterol levels come down. So it is a key piece of, yeah, just
Yeah,
getting.
I think I don't know if it was your company, but we had a patient recently that had the liver tinctures, and their cholesterol went down with that, no statin, nothing else really, and the liver, because the liver helps to recycle that LDL back to the liver,
Yeah.
and so you need the liver to be working for your cholesterol to be lower for sure. What are your recommendations for those without a gallbladder?
Right.
Maybe if you want to clarify that question, but yeah, I guess if someone doesn't have a gallbladder, what would you do? What
Right.
kind of?
So the liver and gallbladder do work closely together. And once your gallbladder is gone, your liver will tend to struggle more because normally bile is produced in the liver and then it flows, it kind of drips steadily into the gallbladder where it's
Mhm.
stored.
Yeah,
And then when your gallbladder contracts, you get a whole lot of
it's a
bile.
little pouch. It's a little
A
storage
pouch,
pouch. Yeah,
exactly.
yeah.
Yeah. So with that pouch gone, basically you're relying on the liver's steady dripping of bile, which often may not provide enough for like a particularly if you eat a fatty meal, you might not be getting enough bile to help
Mhm.
digest it right at once. So if the gallbladder is gone, we focus a lot on the liver, on just improving the liver health. We have two tinctures that we recommend for people who are just trying to help their liver, and that would be our Chinese bitters and our Coptis tincture. The
Yeah.
Chinese bitters basically just opens up the bile ducts and
I think
softens
Coptis
some
is
bile.
Coptis used for Lyme as well. I think is Coptis, or am I thinking of something else?
It could be. I know that Coptis is also really good for Helicobacter pylori infection.
Oh, nice. Okay. Yeah. Yeah.
Yeah, it's a really good antibacterial and anti-inflammatory. So, and it strongly stimulates bile flow.
Great. Thank you. Yes, H. pylori. So you said Coptis. Anything else for H. pylori that you see helpful?
Yeah, I know that they've actually done studies on Coptis and found
Mhm.
that it kills that particular bacteria.
Great.
Yeah.
Okay, what are your recommendations for blood sugar balance? So, 90% up to 87 to 90% of the population has metabolic syndrome, even if they're not clinically over obese or overweight. There's a there's trouble with detoxification, there's trouble with storing energy, too much energy stored as fat, and there's not enough energy utilized by the cell. So metabolic syndrome, which can encompass high blood pressure, high cholesterol, or um, uh, let's see, or high cholesterol, that's going to be, and then of course excess belly fat.
Mhm.
Those are all part of the metabolic syndrome. But what do you recommend for, I guess, metabolic syndrome, losing weight, blood sugar balance, all of that?
Right. Yeah, again, it's mostly comes down to the liver. We've had a lot of people say that after just using our Chinese bitters tincture, maybe doing a liver and gallbladder flush. Not everyone wants to do that, so it's up to the person whether they want to. But we've seen dramatic reductions in blood sugar, blood pressure,
That's great.
and
How often do they do the liver cleanse, or I mean, how many days? What's the general amount of time?
so we usually recommend if you're going to do a flush that you use our tinctures. We have like a 4-pack of tinctures that basically gets the liver and gallbladder, everything dissolved and bile flowing better before you do the flush so that when you do it, it's more likely to come out easily and nothing's going to get stuck.
Hmm.
Yes. So if you're going to use the tinctures on their own, because you can also use them without doing a flush, it might take a couple of months, depending on how severe the problem is. Whereas if you do a flush, you can get more dramatic
What do you mean
results.
by a flush versus the tinctures? Can you just differentiate that, please?
Right. So the the tinctures basically will do the work if you give them enough time and you're patient. But with a flush, that's when you fast on apple juice for 2 days. The malic
Mhm.
acid in the apple juice is a very good bile solvent, which
Mhm.
helps to release any stagnation there in the liver and flush it out. And then you take a mixture of olive oil and lemon juice to force the gallbladder to contract and push out stones.
Great, thank you. I know had some people do the liver and gallbladder flushes and had really good results with that.
Yeah.
Okay, does improving liver health help thyroid and sex hormones to better regulate? It should, because the liver is producing some of those binding globulins, those proteins that help bind those hormones. But yeah, what's your answer there?
Yeah, it's really amazing actually. Like in terms of fertility, we've had some women who've tried for years to get pregnant. They've even
Hmm.
tried in vitro fertilization, and they
Hmm.
take our Chinese bitters tincture, which is really just a tincture to, as I said, to get the liver working better. And after just a month or two of taking that tincture, all of a sudden they get pregnant, and they're often just astounded that this
That's amazing.
happened.
Yeah. What is in the bitters formula? Are there?
It contains Chinese gentian root, bupleurum root,
Mhm.
scutellaria root, and also atractylodes root, which is a spleen shoot tonic.
Oh, I don't know that one. The last one I don't know. Yeah, that's great. Okay, can a liver flush be done if a person does not have a gallbladder?
Yeah. If you don't have a gallbladder, obviously we would not be so worried about gallstones. In that case, you would be more concerned about the apple juice fasting portion of it, because that's the part that really helps to decongest your liver. You could also still do the olive oil portion of it, because sometimes there might be lingering stones in the common bile duct after the gallbladder is removed, or sometimes we've had customers have gallstones in their liver, because if you don't have a gallbladder to store bile in, the stagnant bile stays in your liver and gallstones can form there.
Yeah.
Yeah.
Great, thank you. All right, I'm getting back up. I think I skipped a couple questions here. So, what is your approach to low thyroid? You know, there's a lot of people that have either hypothyroidism, which is a low thyroid condition, or they have autoimmune thyroid, which then leads to a low thyroid condition, something called Hashimoto's.
Mm-hmm,
Um,
mm-hmm.
what are your thoughts about supporting the thyroid herbally
Right.
or with TCM?
So again, a lot of people with hypothyroidism and hyperthyroidism have found that decongesting the liver helps, just because the liver is the organ that converts T4 to T3, the active form.
Yes, yes.
So especially if that is known to be the problem, then certainly cleansing of your liver can help that. You can also support your thyroid with seaweeds.
Hmm.
Um, like dulse and kelp are really good products you can also take while you're taking the Chinese bitters to help your liver.
Nice. Okay. Dulse from any source or like a organic, does it matter?
I mean, obviously, if you can find an organic source, that would be best. Yeah,
How can you tell if you have liver stagnation? What kind of physical exam or I don't know, what kind of signs would you have?
right.
Would it show up on lab work at all, liver stagnation?
Yeah, unfortunately, that's the thing about Chinese medicine, is that liver qi stagnation is like one of the most common diagnoses in Chinese medicine, and yet, on from a Western perspective, you can't really detect it. Like, there's nothing.
Yeah.
It's a qi stagnation, so there's not anything
Yeah.
there.
I mean, I took a medical acupuncture course here in
Mhm.
Potomac, Maryland, and almost everyone had some sort of liver stagnation. And
Exactly,
basically, if you're chronically stressed, you're going to have
exactly,
liver stagnation. So who doesn't have that right now?
exactly.
If you're chronically depleted, fatigued, overworked, not sleeping enough, then you also have kidney qi deficiency. That's another issue.
That's
Like
another issue
sort
too.
of like what is your vital force? So it's not that you're not healthy, but are you vital? Like, do you have like optimal energy? Right. That's what we're all looking for is optimal energy.
Right.
We want to be healthy. We want to be free of disease, but it's not just about being free of disease. It's also about being optimally healthy.
Exactly. And I think that's where Chinese medicine really excels.
Yeah.
Yeah.
Yeah. For prevention as well. I mean,
Yes. Yeah.
huge. Oh, okay, great question. Let's see. I know we're gonna go to, let's see. I know there was one. Oh yeah. Okay. What would help? Okay, a couple more on this side. Autoimmune conditions in general. So hypothyroidism is one thing, but this is a tricky one because there's so many different autoimmune conditions now. One of the general comments I have to make about autoimmune conditions is it's actually number three right now in terms of I think behind heart disease and cancer are two of the big killers, or people have a lot of that, but autoimmune is number three. And it's even thought that cancer is an immune dysregulation and heart disease is also an immune dysregulation. Like, it's all kind of immune dysregulation.
Right.
In fact, much of heart disease might be autoimmune, is kind of
Mm.
a new research coming out there. But in terms of autoimmunity in general, I would say it's at least number three in prevalence, if not more than that. What's your thoughts about how do you treat that with TCM?
Right. So autoimmune problems, it's usually, like I said, that's a overactive immune response, basically.
Yeah.
And so normally you would strengthen your immune system with chi tonics. When you have an autoimmune system, though, if you use strengthening herbs, that can make the immune system even stronger and react even stronger. So it's not a good approach. That's why we opt more towards, it sounds like I'm beating a dead horse, but we cleanse the liver,
Hmm. Hmm.
because the liver and the spleen pancreas balance each other. So oftentimes, if your immune system isn't weak, that's a sign of a spleen weakness. Just by decongesting the liver, it takes the pressure off the spleen, and then the spleen can strengthen. And that way you indirectly strengthen the spleen, and that doesn't allow, like, the overactive immune, it doesn't aggravate it, the
Okay.
overactive immune
Um,
response.
I'm making sure I get to all the. Thank you, thank you. This is great. Thank you, Rebecca. Okay, Mustafa asked, what would help in maintaining uric acid levels? I think if the uric acid's too high, we know that uric acid can crystallize and cause gout. Gout
Right.
is a painful condition of the knees or the toes or in different places. We know that gout can be caused by elevated purine diet, including excess alcohol, meat, or seafood,
Mhm.
or even fruit can actually, too much fruit. I think fruit's a good thing. Fruit's a health food, but too
Yeah.
much fruit is also not good in terms of uric acid levels. But from a herbal and a TCM perspective, what are your thoughts about helping to maintain healthy uric acid levels?
Right. So usually, if your acid levels are increasing, it's because your kidneys aren't able to flush the uric acid from your body as well. So normally there might be some kidney cleansing and strengthening that you could do to help prevent that. In Chinese medicine, gout it falls under the condition is called wind dampness.
Okay.
I know sounds kind of weird, but it means basically there's like too much fluid in your body. So sometimes some draining herbs to drain excess fluid also help.
Okay. What are some draining herbs that are good, do you think?
So one of the big ones is fuling or pariah mushroom. We
Okay.
also gold coin grass itself, which dissolves kidney stones, is a diuretic herb. Corn silk,
Okay.
that's
Oh, got it.
another good one. Yeah.
Thank you. All right. So some help with, yes, this is definitely help with IBD. So IBD is inflammatory bowel disease. This is a pretty serious condition. This can be very life altering, or, basically you need someone running the bathroom 6 times a day, right?
Mhm.
IBD, any help with IBD or ulcerative colitis, things like that,
Right.
especially if
Again,
they're
yeah, it
wearing.
depends kind of on the person and the presentation of symptoms that they're having. But usually, IBD is like an imbalance of the liver and spleen. So if there's more diarrhea, that's a classic weak spleen sign. So in that case, you may want to use more herbs to boost the spleen. Whereas if there's more constipation,
Mhm,
especially even diarrhea, if your diarrhea is really smelly and stinky, then
mhm,
that's like a liver qi stagnation problem. So in that case, you would focus more on decongesting the liver. But usually it's an imbalance between those organs, and you just got to find the right
mhm.
balance.
What are some things you said? I think you said this before, but what are some herbs to help boost the spleen?
Right. So spleen chi tonics, you've got ginseng root.
Okay.
That's a big one, although it tends to be very heating. We say
Mhm.
heating in Chinese medicine. So that's one you probably wouldn't want to take very long because then you can start to get sort of inflammation symptoms in your body.
Okay.
But for a quick boost, ginseng is one you could try. Cotinopsis root is a good substitute because it's not as warming and it's more gentle. You also have astragalus root, which is, again, that's the one that really boosts your immune system. So that's one that's good, particularly around now for since we have
Yeah.
COVID
What
going on.
about cooling the system down if someone's in a flare of like a gut flare, IBD flare?
Right.
Does it
So
need?
again, sometimes if it's like an excess heat condition,
Yeah.
that would be a sign that your liver is congested and you need to drain it, and that will basically unlock bile flow and get your intestines
Yeah, the
all.
bile flow seems to be a big key there for sure. Yeah, great. Let's see, how does pulse reading work? Yeah, yeah, that's good. We didn't really cover that yet. So how do you take the pulse in traditional Chinese medicine? How does that actually work?
Right.
How does that help you make a diagnosis and treatment plan?
Yeah, it is kind of interesting because how they ended up on checking the pulse in your wrist. I know that in ancient times they checked it on your neck, on your temples. They've checked it in different places, and I guess because it's less intrusive, they kind of landed on a wrist pulse. That was a good way to tell. And I mean, even Western medicine does feel pulse, and you can tell certain things from the pulse, like how rapid it is, how strong it is, how weak it
Right,
is.
right.
So it's kind of along the same lines, except in Chinese medicine, we've assigned different organs to different pulse points on your wrist.
Mhm.
And you can tell based on how strong or weak it is on each particular point, which organ might be in need of help.
Got it. Yeah. So there's basically, if I remember correctly, there's three. There's like mid radial, and then there's distal and proximal radial, and then there's basically shallow and deep pulses, right?
Exactly.
There's so
Yeah.
many different.
Yeah.
Yeah, our acupuncturists here are amazing at that. I'm like, I can't. It's hard to do, but you can find out a lot from the pulse even after you treat pre and post acupuncture. You can see the pulses start to normalize,
Yeah, yeah.
everything kind of she's flowing more. So our acupuncturists are really that's always just amazing to me how that pulse changes so quickly. And
Yeah,
so do you see that change with the herbs as well? When you take the herbs and then if you take someone's pulse, you can kind of see that
you
change.
can. Yeah, you can feel
Cool.
the change. The herbs might be a little more gradual than acupuncture,
Hmm.
but you can feel the difference when a formula is really working. It
Hmm.
definitely changes.
What about acupuncture plus herbs? Someone asked that, which is, I think, a great question.
Mhm.
Would acupuncture help with decongesting the liver? I would think that potentially acupuncture plus herbs might be helpful.
Yeah, it is a good combination, and I think a lot of acupuncturists often find that they want to start learning about herbs because basically the acupuncture can help in the treatment, and maybe for several hours after, but the herbs can give you a more long lasting that you can
Okay.
continue on for days afterwards in
Yeah.
between
Yeah.
visits, whereas the acupuncture is just
Probably can't go to acupuncture every single day.
exactly. It's
Although
not.
in China they do that apparently. That you're apparently they do that in some of the Chinese hospitals.
Wow.
You just go daily, once
Yeah,
a day acupuncture, twice a day acupuncture, or something like that.
yeah.
Anyway, okay, so okay, would love to learn more about TCM. Where's a good starting point? Yeah, I don't know. That's a good question.
Yeah, that is. I mean, there's I think in California there's a lot of good TCM schools.
Hmm.
Um, you can probably look in your area. There might be probably all along the northwest, even like in the Seattle area. I wouldn't be
Yeah.
surprised if there's some good schools there too.
Yeah, I wonder, Jen, do you know if MUIH, do they have a Chinese herbal program? I think MUIH does, right? Yeah, let me see. Okay. One person, Catherine, saying when I eat, she gets tingling in her nose and face, some body tingling, happens with protein, happens with hot or cold drinks. Digestive system nerves are highly sensitive, and nervous system is stuck in fight or flight. Uh,
Right. So
yeah.
I suspect to me that sounds like a kind of a yin deficiency problem, where she would need to use some sort of nourishing yin tonics to calm down. Basically, the nerves have like the myelin sheath that
Mhm.
protect them when they're firing so much. So
Yeah.
it might be a sign that she needs to provide more nourishment for those nerves to keep them from firing. Mm.
So in terms of TCM translation, that would be to nourish the yin. Is that right?
Exactly.
Okay,
Yeah.
got it.
Mhm.
Great, thank you. Any connection with herbs in the vagus nerve? I guess in other words, I think that question means if you take herbs, what does that do to the vagus nerve? I'm assuming it would kind of tonify it almost, but is there any
Yeah,
thoughts?
again, you'd probably be looking at some yin tonics, and they would. Yin is an overlooked concept. I mean, a lot of people think, oh, I'm fatigued, so I need more energy. But
Mm,
sometimes what it is that your body's just depleted in like nutrients, especially since the Western diet is not that great at providing nutrients,
mhm. We
especially
call it the SAD diet, the standard American diet, but I don't know if
exactly.
there's a corollary for Canada. Is a Canada diet also that way, if it's like a standard diet or?
Well, yeah, we generally figure that our diet's pretty depleted in nutrients. So, yeah. So
Yeah.
basically, like yin herbs, especially the cooling ones, they can actually give you energy just because they're providing those nutrients
Hmm.
that you're
Well,
not
since
getting
we talk
from.
a lot about liver here, what are some foods? We know what foods to avoid. What foods are good to support the liver?
Right. So basically, it comes down to anything green. Green is the color of the liver, so you want your leafy green vegetables. Even something like cucumbers can help.
Great,
Avocados are green, and in moderation, those can be helpful to the liver.
great.
Artichoke, of course, is also green and known to help the liver. But then again, you also have like berries, like raspberries, blackberries,
Hmm.
um, mulberries, particularly, are really nourishing to the liver. So,
Yeah,
as well.
blackberries are great for the esophagus as well, the antioxidant effect.
Hmm.
Nice. Okay, this is a question a little bit for me. How would you recommend patients use the ideas and information from this webinar in conjunction with functional medicine treatment? I think functional medicine and TCM are kind of like two branches of the same, almost like lineage of root cause resolution medicine, right? It's kind of like, what's the root cause? What's going on? Let's get to the root. Let's nourish the root that will nourish the branches. That's kind of this idea of the
Exactly.
branch root kind of thing. So I think in terms of, I'm not an expert in TCM. I've done some training in medical acupuncture, but I think we would potentially, for instance, consult with Rebecca here, who knows a lot about TCM and TCM herbs. I mean, there's probably, we can also, make sure that to check the supplements or medications or interactions and things like that. We don't want people to be on too many things, but
Mhm.
I think there's different ways to treat a person, from either a Western, more of a Western herbs or, supplements, nutraceuticals point of view, medications even, and traditional Chinese herbs. So I think there's just some interplay there. So a lot of good communication and cross referral, I think is probably what I would recommend there,
Mhm.
from someone knowledgeable, in this.
Right.
Yeah. MUH, yes, MUH has a herbal program. Okay, great. Do you ship your products to Maryland? We'll be talking with Rebecca about that. We'll be trying to figure that out. But you do ship worldwide, or where do you ship?
We do ship worldwide and
Okay.
into the US daily, yes.
Okay. Yeah, we'll see if we can carry some of your products here. That would be pretty great there. Um, I think we can talk about that. Um, Yeah, how many people, I mean, you can put on here if you'd like. Are you interested in learning more about TCM herbs? And, would you want us to carry it here? If you could just put that on the chat. I'm definitely interested in that liver tonics, because that's just such a huge, piece. Definitely the kidney
Yeah.
chia as
Mhm.
well. Yeah, so how can people, let's see, how can people work with or order the formulas? Yeah, so you have a website, I think. We'll see
So
if we
we
can get it
have a
here. Also, you can just get it from here too. But you,
mhm.
you have you have a website or something that people can go to.
Yeah, our website is www.sensiblehealth.com, and yeah, you can order products from there.
Great, great. Okay, and some people are interested in us providing products, so we'll reach out to you, Rebecca, later. Thank you. And then, yeah, Sherry said she's interested. Previously treated by a past acupuncturist with herbs. What has your experience, Sherry, with that? Was acupuncture versus acupuncture and herbs together? Was that helpful for you? I think there's the same treatments can interact with the person and their body differently. So some people do better with just acupuncture. Some people do better with herbs. Some people probably need a combo. So I think it's yeah. Is it better to have a consultation before ordering products? I would think so. But what do you
Yeah.
do for that? Yeah.
So yeah, sometimes people are just, I mean, obviously if you're having gallstone plain or something, then you're pretty sure what the problem is, what you need to do. But I do get a lot of people who you can just contact me at rebecca@sensiblehealth.com, and I can help you kind of sort through your
Hmm.
symptoms and figure out what the predominant problem is.
Hmm.
You can also call. Our phone number is on our website too, if you prefer to talk.
Yeah. 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 I think email is a good way too. Yes, I put that on the chat, Rebecca at sensiblehealth.com. Thank you. So you do test for heavy metals. You've never found a batch, which is great, with heavy
Yeah,
metals in
never a
there.
single time. Yeah.
There's always a risk of that, but it doesn't sound like that's been an issue, which is great.
Mhm.
Um, and let's see. So, is there anything else? Yeah. So more about TCM herbs for liver and H. pylori. Do you have any blogs or webinars on that? I think we have talked about it some. Maybe Ellen, if you want to email Rebecca, and maybe she can talk to you more about that there. Yeah, it's Coptis. It sounds like is a big one for H.
Yeah,
pylori,
definitely. Yeah.
and then some of the liver support, like you
Mhm.
said. And there's some formulas that your herbal shop has. That's great. Oh, okay. Gluten-free products. Are they gluten-free? Are there any animal products in the herbs, like those type of things?
Right. Yeah, there's no animal products in our herbs, and they are gluten free. There's no wheat products in them.
Kosher. I don't know if that comes up at all, but is there any kosher? I'm not sure if that how that works, but
Yeah, I'm pretty sure they're kosher too. It's just
okay.
basically herbs and
Herbs. Okay. Okay.
alcohol and water. So yeah.
Yeah. Okay, this is a really basic question because I just never know the answer to this. Is with the alcohol tinctures, how much alcohol is in there, right? Because we're talking about liver detox, but then if it has alcohol in it, how much is in there?
Right.
Is
So
that
most of
significant or yeah?
Yeah, most of our tinctures are around 20% alcohol, which, you might think, okay, that's actually pretty high, but you're only taking a teaspoon a day, so you're really not getting that much alcohol.
Mhm.
And the alcohol is actually important because it not only extracts certain properties of the herbs that are particularly good for the liver, the herbal properties that we want. But the alcohol itself directs the herbs right to the liver area.
Got it.
So it's actually an important component. We do sell our GCG tincture in a glycerin format, which only has
Yeah,
5% alcohol for people who are nervous
they're
about
sensitive to,
alcohol. And
yeah.
we do have capsules of some of our products too. But
Yeah.
yeah,
Yeah.
there is a reason why the alcohol can be beneficial.
Got it. Got it. There's also this potential epidemic of low stomach acid. This idea that the stomach is just not the stomach and the small intestine down the line are not digesting the food that well because of low stomach acid, low digestive enzymes. The
Mm,
stomach also, by producing stomach acid, acts as a conductor almost in a digestive symphony, whereas it gives you the signals to the gallbladder, small intestine, and pancreas to produce digestive enzymes. So we see that a lot in our practice. Are there any herbs that would potentially help with either regeneration of the pancreas, let's say, or to help with low stomach acid? I mean, these are kind of general questions that I had.
So yeah, what we usually recommend is our Chinese bitters tincture.
The bitter,
It's
okay.
just like the Europeans will often take a little bit of a bitter substance.
Swedish, like the Swedish
Small
bitters.
amounts of bitters actually
Yeah.
stimulates hydrochloric acid production in your stomach as
Mhm.
well as digestive enzymes. So if you take
Yeah.
that half an hour before a meal, it can stimulate all those digestive processes. Yeah.
Great. And then a question on Chinese medicine and nutrition. I know in Chinese medicine, the idea is that you're supposed to eat warming foods in the winter, like it's winter right now, and like more cooling foods in the summer. Is that pretty much what we would say there?
Yeah, a lot of people eat. I mean, drink a lot of drinks from the refrigerator, and they eat
Mhm,
like raw foods in the winter. I know raw
mhm,
food diets are often pretty popular, especially for weight loss. But in Chinese medicine, we see you don't really get the nutrients from the vegetables when they aren't cooked. So
mhm.
there's actually a book that I read once by a scientist, and he actually theorized that one of the things that caused humans to become human and make our brain grow was that we started cooking our food rather than
The
eating it
nutrient
raw.
density goes up.
And you can actually
Okay.
see when you cook vegetables, like lightly steam them, that they become darker and richer in color, and
Yeah.
that's the nutrients coming out.
Ah,
So
okay. So make
you
sure to drink the broth too. You got to drink the
fruit,
broth
yeah, if you
after you're
boil
steaming
it,
them.
you want
Yeah.
to get some of those
Yeah.
nutrients there too.
Yeah. Yeah. That's great. Yeah. And then I think that's definitely true with the water, right? Because we're always like, let's get the ice cold water, let's get the cool
Yeah,
beverage, get the
yeah.
Starbucks, right? You're not getting I guess
Mhm.
people are drinking the iced coffee with sugar, right? Things like that.
Exactly. Yeah. I mean,
So
you
yeah,
want to warm up your digestive organs and get them ready for the food that they're about
that
to
makes
receive.
sense.
And
Yeah.
if you drink something cold, everything kind of contracts and shrivels and it's not going to function properly.
Right.
Yeah.
Right. Okay. So we have your contact information here. We'll talk more about herbs and let me see if there's one other question. Yes, thank you so much. Thank you, Catherine, for the kind words. That we really had a lot of great discussion here and a lot learning about TCM and herbs. So thank you so much, Rebecca, for coming on and look
You're
forward to talking
welcome.
with you again soon.
Yeah. Yeah. It was great.
Julie, I don't know if Julie wanted to chat here. Your hand is raised, so I'm gonna put you on if you want. Hold on.
I
Okay,
think that
not
was the
raised
one
anymore. Okay,
whenever.
I think we answered that question. Let's see. Okay, great. Well, thank you so much, everyone. We'll see you again next week with Dr. Jones. Thanks, Rebecca. See you later.
Thank you. Mhm.
Thanks.
Bye.